What's up, everybody? Dr. Alex Spinoso, Medical Mondays. So today we're going to talk about something that I knew was going to be brought up at some point. I'm not going to shy away from it. We're going to talk about it today. So the question is there a way to stay safe while on performance-enhancing drugs, PEDs? Same questions I've also gotten. How long should you stay off between cycles? How long should I be on cycles to be safe? What should I do during cycles to be safe? So let's dive into this. I'm going to tell you what the truths are, really, in the end, because you pay me to tell you the truth. Actually, I don't get paid at all. Well, anyways, you're here because you want to know the truth, and I'm not going to give you some bullshit, fluffy answer. So, number one, performance-enhancing drugs, when used outside their original intent and outside normal physiologic parameters, really is what I call dark medicine. Nobody studied it. Nobody's probably going to study it until steroids or PEDs become legal, if they ever do become legal. So pretty much everything that you see on the internet and everything you research, for the most part, is going to be hearsay or what people believe to be true. There was really only one medical study in 2006 that stated existing data suggests that in certain circumstances, the medical risk associated with anabolic steroid use may have somewhat been exaggerated. Number two, there is absolutely no way to tell how your body is going to react to PEDs today, 6 weeks from now, 10 years from now. Absolutely not. Anybody who says, don't worry, if you take this, you'll be fine, or I've done this 1,000 times before, they haven't dealt with your body. So anybody that says that this is how your body's going to react exactly, this is how you're going to feel react exactly, this is how your labs are going to look exactly, has no clue and are full of shit. Number three, in terms of cycle length, how long you should be off in between cycles, there is no set data and there's no recommended amount of time. I've had patients that have done one cycle for 6 weeks and then a year later they're still having problems with their sex hormones. I've had patients that have taken cycle after cycle after cycle, 10, 12, 16 weeks, and still their labs look great. There's no way to tell how your body's going to react to it. I can't recommend steroids, obviously. It's an illegal substance. There is a huge amount of data going against it. All the side effects in the world, you can Google it. They're all there. Now, that being said, just like the studies that have shown that McDonald's food makes you fat, you're going to do it anyways. The biggest side effects of PEDs that I see in the clinical setting are going to be depressed HDL, which is good cholesterol levels, increased blood pressure, which is from a bunch of different ways. There isn't really one set way that they have studied and showed that PEDs increase your blood pressure. There's actually a bunch, and it's still pretty much hearsay as to what exactly is causing it. You have increased estrogen levels causing gynecomastia, reduced sperm counts, voice changes in females, and really, in the end, the psychological effects, the roid rage and the depression that goes along with it. There is no way for me to tell you at what levels of drugs or how many weeks or how long that it's going to take for any of these to happen in you, if they do happen in you. There's no data for that. Nothing at all. The only thing that may keep you slightly safer, and I use safer in quotations because this is experimental medicine, nobody really knows, is getting your labs. You should be getting your labs no matter what if you're going to do any type of PEDs. You should be getting your labs before you do PEDs, during your PEDs, after your PEDs, every 3 to 6 months, as well as getting an EKG every year. EKG is going to check the heart, see if there's any cardiomegaly patterns with it. You should have that EKG read by somebody who deals with athletes, because an EKG from a couch potato is going to be very different from an EKG of an experienced elite athlete. The labs usually taken are your complete blood count to look for thickening of the blood and any type of inflammation. Your complete metabolic panel, CMP, is going to look at your liver, your kidneys, your metabolites. You have your testosterone and epitestosterone levels. You have your LH and FSH that are going to look at both your gonads and your pituitary glands. You also want to make sure that you're getting your thyroid checked, as well as in males, your PSA, prostate-specific antigen, because steroids is known to cause increased risks of gonadal cancer in males. Another friend asked me if he should get an echocardiogram in order to check for his heart recently because of what's happened with the PEDs and famous bodybuilders passing away, things like that. It's always better to be on the safe side and get these types of tests as often as you possibly can. Will a physician order it for you? Likely not, because there's no way to justify it other than a patient is taking a performance-enhancing drug, something that is illegal, and every clinic, every doctor is going to be very different when it comes to their patients using illegal substances and how they deal with that. So I can't tell you how any other clinic is going to take care of that, other than that you're presenting something that's illegal to them. Are they going to call the police? No. Are they going to take you to jail? No. However, it's something that they're not going to really probably want to get involved in. That being said, there are a lot of companies that you can order your labs from online, things like that. Can I recommend that? Not really. I'm just telling you what's out there. So most of the side effects that are associated with PEDs have been shown to be reversible, really except for voice changes in females, as well as psychological factors such as depression and rage and stuff like that. Those actually haven't shown to be as reversible as everything else. In the end, what's the truth? I have no idea. Science has no idea. There is a bunch of data backing up the poor effects of PEDs, how it can affect the body, how it can cause issues. Every type of physician, every type of society that deals with hormones is going to be against using these PEDs outside of normal physiologic parameters. There is no data to support that it's good to be doing this outside of physiological parameters. So your labs are really the only thing that you're going to be able to try and take care of yourself. But in the end, there are no guarantees. Finally, the most powerful anabolics are going to be the ones that have the most side effects. So the anabolics that allow you to grow the fastest, achieve the most muscle mass, achieve the hardness faster are going to be the things that have the side effects faster than any of the others. In the end, there is no way anybody can tell you how PEDs are going to affect you today, 6 months from now, or 10 years from now. And that's the truth.